You can hardly turn on your television or open a website or a news website or read a newspaper without hearing healthcare premiums are going up by dramatic amounts. What can we do about this? Let's talk about it. Hi, my name is Andre. If this is your first time here, thank you so much for stopping by. I truly appreciate it. And if you're coming back, as always, my sincerest thanks and gratitude for your checking back in with us. All right, let's dive into this. Okay, so every news article, these days is talking about how the healthcare premiums are going up and by dramatic amounts. I mean, I keep hearing like 75% and so on. And that is scary, especially if you are contemplating retirement in the not too distant future, recently retired or in retirement, but not yet Medicare age. You're typically going to be using, once you leave employer subsidized healthcare, you're going to be going to the ACA, the Affordable Care Act, marketplace to get your healthcare coverage. And in so doing, you're typically going to be applying for subsidies, but these rates are going up by really dramatic amounts. So I want to get into some very specifics of my particular situation, just to give you an idea of what I ran into when I went to look at this. And it is scary, but in my particular case, it is manageable, he says with, carefully. All right, so let's get into some very specific numbers and see what I was running into. All right, so for those of you who haven't been here before, my wife is older than I am, and she is on Medicare. I am, not yet 65, so I get my health care coverage through the ACA marketplace. All right, so the without subsidy premiums for me for 2025, the current year that we're in, were $1,452.40 per month. Next year, that will go up to $1,741.41. So almost $300 from year to year. It's almost a 20% increase, going up from about $1,500-ish to about $1,800-ish, going up about $300. So it's a little more than 20% there. Now, that's not what I pay because, as we've managed our income and so on, we get subsidized health care through the federal government. And the subsidy that I was receiving in 2025 was $1,119.95. And that's going to go up to $1,315.25. So immediately you'll see that the amount of the subsidy does not completely override or offset the premium increase from year to year there. But it is helpful, and I am very grateful that we are getting some help. So what has happened there is my monthly costs have gone from, I had been paying $332.45 per month. That is after the government subsidy is taken out from the actual total amount of the premium. It's now for next year going to go up to $426.16 a month. So roughly $94-ish. Now, that is significant. It's $94 a month, it's over $1,000 a year that I, all of a sudden, now I'm going to be paying more per year for my healthcare coverage. And all that has changed that I've been able to see here is that my copay went from $20 to $15 per visit. So if you do 5 visits a year or whatever, you save $25, or what have you there. So again, totally grateful for the ability to get healthcare at a quote-unquote relatively reasonable rate, but my healthcare costs are going up $94 a month, which is significant and is just something you have to absorb into your budget. All right. So while I went looking, trying to figure out, what can I do? Maybe use a different plan. The plan that I have is a HSA qualified goals plan that's with a PPO. And I'll talk more about what a PPO is here in a second. So I went looking on the marketplace for my state to say, hey, what might be available? And they had what is essentially the exact same plan from the same company there. But the difference was one was an EPO and one was a PPO. Now, I wasn't 100% sure what the difference between those was, is, so I, good old Google, and got this definition here. I'll just read it. It says the primary difference between an EPO, which stands for Exclusive Provider Organization, and a PPO, Preferred Provider Organization, is out-of-network coverage. EPO plans generally do not cover out-of-network care except in emergencies, while PPO plans do, but at a higher cost to the member. So what's going on there, as I've done a little bit of research on this, is the PPO, which is what I have, they prefer that I go to an in-network doctor, and there's a specific, structure for what they charge, what the cost would be to me for that. Or if I went to a provider that was out of network, then there would be a specific breakdown that says, oh, we're only going to pay up to 80%, or we're only going to pay to a specific dollar amount, or what have you, and then I would be responsible for the rest. Whereas an EPO, if I go to an in-network provider, we're good to go. We follow whatever the established structure is. But if I went outside, if I needed a consult, or if there was not a physician available in the particular area of medicine that I needed, and I went to someone outside of the provider organization network, then I would be 100% responsible for that if it was a non-emergency situation there. And the difference in prices were, substantial, but, in the end, I ended up going with the PPO and sticking with the PPO because I just was really concerned about what ifs. So just to give you some numbers here, the PPO, like I said, my premium monthly cost for next year is $426.16 for the PPO version of the plan. It would be $132.35 for the EPO version of the plan. That's almost $300 a month more. So times 12, that's $3,600 a month more, a year, excuse me, not a month, more. But I was just more comfortable sticking with the PPO version. Of course, you would have to make your own decision as to what works for you. When I went, I can look up doctors that, providers that are in the networks, and I immediately saw that my PCP, my primary care physician, was not in the EPO plan. So I would have to select a new physician who was in network, maybe at a different provider or what have you. Or if I decided to stay with my established doctor, then I'd be paying out of pocket because they're out of network, and I would have to pay all of those costs myself. That could get very expensive very quickly. Some of my providers were, I think I have a urologist and I think my cardiologist were both in both of them, the EPO and the PPO, but my PCP and somebody else, I don't remember of the various tons of different doctors that I have, was not. And I was just more comfortable, me personally, more comfortable in sticking with the PPO, even though it was going to cost me more money to do that. That may or may not be the correct decision, but it's the decision that I am most comfortable with. So that's what we decided to do for our healthcare over here. But every state, as far as I know, has a marketplace for you to go to where you can look up this type of information. It says, here's what my expected income is for the year. Here's the zip code that I live in, because I think they do it by zip code or by county that you live in or what have you. They say how many people are in my household, what their birth dates are, etc. And they will then come back and say to you, oh, you qualify for a subsidy of X amount. And then if you can give you a list of all the plans that are available, and you can look at bronze, silver, gold plans. You can say, do you want to get an HSA qualified or not? PPO, EPO, there's a whole bunch of different choices that are available to you. You put in all the different things that are applicable to your particular situation, and then they'll show you what plans are available and the pricing for 2026. And you can go in and make your selection. We're in the middle of open enrollment right now. I'm recording this video in November of 2025. And I believe open enrollment continues through December 15th. I'm not 100% sure on that, but sometime in December. and you want to make your selections for your coverage for next year before that deadline so that it can go into effect on January 1st for you there. And that you do it within the open enrollment period, because outside of open enrollment, there are other things like, you know, you may have to do a physical exam, or you may need to, you know, have some medical questions and stuff like that, which you don't have to do necessarily in during the open enrollment period. All right, so just wanted to share that with you. It's rough, and prices are going up and relatively dramatically there. But in my particular case, again, like I say, I keep saying this in quotes, it's manageable, and certainly I would prefer that it didn't, my costs didn't go up that much, but they have, and I have to adjust to that as well. All right, so that's what I wanted to cover today. As always, thank you so much for stopping by. I truly appreciate it. If you got something out of this, I ask that you give me a like, and if you know anybody else who might benefit from this information, please share it with them. If you're not yet subscribed, please go ahead and subscribe. We're trying very hard to grow the channel. We sort of seem to be stuck a little bit. So I'm going to ask you to throw me a subscribe if you think that the information is worthy. And if you would feel free enough to share what you're doing about healthcare in your retirement years, especially if you're pre-Medicare and you're dealing with the "I've retired, but I'm not yet Medicare eligible." If you could put what's going on with you in the comments below, I would truly appreciate reading what is going on with other people. All right. Again, thank you so much for stopping by, and as always, in Alita Times.